mind. And, as we're waiting for them, just note that our website, thediv.com/telesales, does have a lot of this information that we just throw up there for you to watch and kind of review on your own time. You are going to need that in a few minutes when Nicole hops on, because she has your website has a presentation, our scripting, and she'll explain how you want to download that and use that as well. So just a heads up that that's there, and you're going to be using that in a few minutes. All right, let's begin. Welcome everybody. It's great to have everybody on here. Gotten a chance to meet a few of you over the last couple of weeks, and those who I haven't, we look forward to being able to partner with you. We're pretty excited to be able to truly partner with agents. We have no interest whatsoever in being your upline. We have no interest whatsoever in being somebody that just you consider putting your apps through, if you will. We truly do dedicate ourselves to being your partner, doing everything we possibly can to really step up and partner with you in that from that perspective, whether it be making sure that we're making the investment as your marketing arm, so that you're not going out having to figure out how to get leads and talk to people, whether it be helping you through the sales process of really working with you to get you to the goals that you have, whether it be keeping your expectations correct. Sometimes we get these lofty expectations of I'm going to write 500. Luke heard me on this soapbox yesterday, so forgive me, Luke, but writing 500 apps for AEP might be your goal, and if it is, it's our job to make sure that we fix that and say, no, that's not going to happen, frankly. Your goals should be somewhere. There's 36 days in AEP, 36 days that we have for AEP to be able to work. If you want to work Saturdays, you can increase that to about 50, 55 or so. But an app a day for somebody coming in brand new should be at least your goal, right? And then maybe you move to an app and a half to 2 apps a day is really where the expectations should be set up. We absolutely have agents come in during AEP and go over 100 apps. Rob Loud is one of them, so his first year in. So you can absolutely see that occur. No one's saying that it's not possible, but it's our job to help manage those expectations so that you're not getting frustrated 3 weeks in and saying, man, I'm nowhere near on pace to make this thing happen. I'm not going to be able to hit the numbers that I was hoping for. And now, I might as well just give up, as opposed to, no, my expectations are new. This is a new business that I'm entering into, and I'm creating renewal streams that if I do have 50 apps in, that there's a potential of more 50 apps in literally equates to about $50,000 next year. So, and renewal, so there's potential here for you to be able to, I think my math's off there. Forgive me. 25,000. I apologize. So the bottom line is, your goal here is to be able to create the opportunity for you to enter into this business, have a goal for that's realistic, that's not something that's too lofty, and be able to truly go after it from that perspective. So without kind of holding up any longer, welcome. Nicole is on now, so we can start up. It's great to see your face as always, Nicole. She's on mute. She does that a lot. She talks when she's on mute. All right. So want to talk a little bit about making sure we're all on the same page here. We have each of you on this phone are going through a presentation of us teaching how to sell telesales, to be able to do telesales enrollments. That's because we have forged a tremendous relationship with WellCare or Centene. This relationship has gone back now. I think 2017 is when it began. And at that point, I think we were trying to write, just a few apps during AEP, try to understand the process and that WellCare Centene has provided for us. And over these last few years, we've really made this a solid opportunity. So solid that we became a national marketer with Centene. As a national marketer, we've been afforded the ability to sell PDP leads. PDP leads are people who are current Part D members, people who are recipients of their prescription drugs with Centene, they pay for all of the prescriptions. Maybe they pay for a plan with them, or maybe it's paid by the government, but their prescriptions are taken care of. As such, Centene is looking to upgrade them into a plan where they get further coverage, like their dental, their hearing, their vision, and a Medicare Advantage plan. We will receive over 400,000 of those leads come October 1st this year. So we're very excited to be able to work these leads. It's a warm relationship. It's when we're calling on our people, I'm calling on behalf of WellCare, your Part D provider. That relationship with Diversified and Centene has afforded us the ability to call on those people and to be able to just upgrade them into a new plan. Over my computer screen right now is my television, and I just saw a Medicare commercial that most people have seen before, right? You're people having to call in and ask for more benefits. It's sort of like a cold relationship. This is a warm relationship. It's a Part D member, somebody who's already receiving benefits from WellCare, and then we're upgrading them to further benefits. So that's the first part. We really do believe in our relationship with them, and we believe that it's afforded us the ability to do better with our agents. It's also on the phone. Okay, everything we're going to be talking about today is selling over the phone. There's an outbound call that's recorded and an inbound call that's recorded, and you are dialing in that system, in that environment. So you're going to be logging into a website, and then our leads are going to be pushed to you through that website. As such, you will not have the ability to sell in the field. Okay, CMS doesn't want us kind of picking and choosing who we record and who we don't. By being recorded, we're getting the benefit of being able to rely upon that recording in the case of a complaint or something going wrong. We always have the protection of that recording because we know we're saying every single thing we're supposed to say. They don't want us to sit there and pick and choose and say, you know what, this specific application, I'm not going to record, because then it's like, well, what did you say that you didn't want to record? Or why did you make sure that you saw this person in the house so you didn't have to say that? So the environment that we're working within is a fully 100% telesales environment. You can sell in the field with us and on the phone. That's an option. That is not the conversation we're going to be having today. And if you are interested in learning more about selling in the field and on the phone, we could certainly have that conversation with you. And it would be a different environment that we do that in. But today we're focusing specifically on the telesales environment. Wanted to make sure that I'm very clear with that, because sometimes somebody sits an hour and a half, 2 hours to this presentation and then says, I don't understand. I can't sell in the field anymore. No, if you go through this process, you cannot sell in the field. I want to make sure we're on the same page. All right. Well, who are we? I want to talk a little bit about Diversified. We've been around since 1979, been in the Medicare Advantage arena since 2004. I guess in the industry, we're kind of known as the Rose Boys. Affectionately, or maybe not. But the bottom line is Mike Sr. started the organization back in 1979. You'll meet him on your conference calls every Wednesday evening at 6:30. We highly encourage you to hop on those 6:30 p.m. calls. Even if you just grab one nugget during that 1 hour call, it's the same call-in number, same Zoom that you're on right now, 6:30 p.m. every single Wednesday night. We just talk about the business, talk about what's going on. Agents are able to drive that call to kind of give us the feedback that they're having, challenges that they're facing, and then we address them. And we make sure that we keep it to an hour to make sure that you don't feel like you've wasted any time. And if you walk away with one nugget, or I should say, our goal is to make sure that each person is able to walk away with one nugget on every call. We have Anthony, our president. He's highly involved in every aspect of the business, but you'll see him on those Wednesday calls as well. He's helped forge that relationship as strong as it is with Centene. And some of you have had the opportunity to meet him through the different satellite meetings that we've had. We have Dan, who's on this call, who's our COO. He basically works 100% in the environment of the telesales. So you'll get to know him really well with this process today. As we continue to grow, he'll be the one who you can call to and kind of have that conversation with whenever there are challenges on the inside or the outside. He's available to you. And then myself, I generally work on the beginning end, which is why you probably spoke with me first, as well as in the lead department. We're going to talk a little bit more about that later. So we have Mr. Collins. You see he's on this call as well. Mr. Collins, well, I should say that these three individuals, Jeff, Akram, and Nicole, represent over 65 to 70 years of relationship with Diversified. All of these three individuals have been in the sales, have been inside, have basically done everything within our organization, and have touched everything within this organization. They are our family. And these three individuals really we trust impeccably to be able to be your support mechanism no matter what throughout this process, and will be available to you. We have Mr. Collins, who's on the call right now. You're going to really get close with him when it comes to get your appointments scheduled and keep your schedule on track so that you know when you're asking for appointments, we're going to be communicating with him regularly. We have Akram Jacob, who's not on this call right now, but Akram, the key to about the important part that you need to know about Akram is still actively in the field. Every one of us have been in the field. Every one of us have a sales experience, but Akram is part of our executive team and still in the field. I think it's important that you know that, because we make sure that those decisions that we are making, they're always with agent in mind. We're never losing sight of what's happening. So Akram still in the field is able to make sure that we don't lose sight of that whenever we're making decisions. And finally, Nicole Moore, who's going to lead today's call, tremendous amount of experience in the field, but specifically on the phone today. You'll see that come through, and we're pretty excited to be able to kind of put her in the driver's seat as we move forward. And you'll see you're going to benefit a great deal from that. Next is our support team. We have Jeanette, Dominica, and Nikki. These three individuals will be your kind of go-to whenever you're having challenges on a daily basis. Most of you have already dealt with Dominica with regard to contracting and licensing, making sure that you're able to start selling. She's our office manager and works with our agents to make sure that they get to the point that they can sell. We have Jeanette, who makes sure you do get paid when you sell, whether it be making sure your calls are compliant, making sure your apps go through, keeping track of any reporting, or just kind of coordinating and kind of creating a concierge VIP experience, if you will, as you work with Diversified. And then you have Nikki Ayuzalino, who is on the 5-9 side, helping to work with the data. She puts our leads in. She's responsible for making sure that you know how to work your leads within the data environment, as well as be able to call on your leads in our system. So she's going to teach you a little bit more at the end of this call, and you'll learn more from her. I did mention already, the div.com/telesales has a lot of the information you're going to need, past recordings of these presentations, other voice recordings of people making sales, as well as contact information of all the people that you're going to need to talk to. This is just a quick list of some of the people that you'll find on there. The left side is all the people, our contact information for you to contact us. Whenever you have any questions, you're going to want to use the Diversified support team, as well as the Centene support team. These are just a small list. There's even more on the website of the people who will be available to you based on the states. Because our relationship is so strong with Centene, we have full access to those individuals who know the product. We've conducted 3 or 4 meetings in the last 3 weeks, and it's over like 25 individuals from Centene have come out just to meet with us, just to say, hey, thank you, Diversified, for everything you're doing. We want to be a support system for you, and anything we can do to further that effort during AEP, we're here for you. And this is just some of those individuals here. The website has the rest of them. So the question you need to ask yourself right now is, am I ready to work? It's my understanding that all of you on this call are, but just want to make sure we just kind of get the foundation set. First, you have to be contracted with WellCare. Second, you have to have completed your AHIP certification. Third, you have to complete your WellCare certification, your Centene certification. And then finally, you need a ready to sell from WellCare that says, yes, you're ready, and you have a login to be able to do so. If you have not completed those steps, please do reach out to Dominica right away. Ask, what am I missing here, and what do I need to do to fix it? Because it is going to keep you from being able to move forward. Our goal, it is September 22nd, right? So our goal is always to get you to the point that you're ready to sell as quickly as possible. This training today is going to go through the process of doing so, and then you're going to be asked to role play with Jeff to make sure that you're ready before we move to the next step. Some of this is a review for some of you on the call. I see some of you have come back just to kind of get the review, make sure you're catching all the points that you need. Some of this is going to be brand new. But over the next 8 days, your goal is to master this stuff so that come October 1st, you're able to truly understand exactly what the process is, know what product you're going to be selling, and then go from there. There's going to be a conversation that does need to happen outside of this call today, and feel free to reach out to me, Dan, Jeff, about that, Jeanette, even if you need to, but about states that you're working in. Once you do have your states that you're going to be working in, we have to make sure the licenses are active within the system, available through Ascend. And we don't want to find that out on October 1st or October 15th when you're going in to actually make the sale that you don't have that state active. There has been problems like that in the past. So let's make sure that we get that conversation locked and loaded as quickly as possible. Technology. The only thing you really need in order to make this thing happen is a computer, preferably not a Google Chromebook, and a headset. Okay, once your headset is in place, you just plug it into the USB and you have activity, you have the ability to be able to sign in, get to the website, and be able to do what you have to do. But the knowledge is what you need most. So I'm going to pass it now to Nicole, and I believe Jeanette is going to take the reins on the screen. And at that point, she's going to take you through the 10 Commandments of Medicare Advantage telesales and how we go through this process as efficiently as possible.
Okay, so while Jeanette brings that up on the screen for me, which I greatly appreciate, good morning, everyone. Happy Wednesday, happy hump day, whatever you refer to it as. Good morning. So today we are just going to go over our scripts. To prepare you, you should have went on the div.com/telesales, and on there, if you scroll down under important resources, there is a bunch of stuff that you need. Okay, your outbound script, your inbound script, your bridge statement. All right. I'm going to ask that everyone go on there, print those scripts out, and most importantly, print them out in color. Okay. Printing them out in color, it's very significant simply because it's color coordinated. It's a map. It tells you where to go with the colors and things of that nature. All right. If any time during this presentation or this training that you do not hear me, or, because the internet is a little shaky where I am, please feel free to stop me, and I'll repeat anything that you need me to, okay? If there are any questions, I will open the floor towards the end of us going over the outbound script. All right, so here we have our 10 commandments, okay, for Medicare Advantage telesales. We have a system, okay, and we simply have a system in place that works, right? So we all have our flow of things. We all have our way of doing Medicare Advantage sales, right? However, Diversified has set up a system for you that works, okay? So in that, I'm going to say, yes, incorporate your flow somehow. However, to be successful, you need to stick to the system that's set up. In that system, we have these 10 commandments. With these 10 commandments, it incorporates our 4 steps in the sales process. All right. So the 4 steps in the sales process is make a friend. That's number 1. Number 2 is to build trust. All right. Number 3, you're going to find or create a need. And number 4, of course, you're going to close. Okay. So you're not going to skip any of those steps. And that's what brings you to step number 4, the closing. All right. Going back to the 10 commandments here, it's going to just let you know the 10 commandments and how it correlates to our outbound script and also the bridge statement and the inbound script. Okay. Again, it's very important that you print your scripts out as opposed to having it on your screen, because you're going to have a lot of things up on your screen. Okay. For instance, you're going to have wellcare.com up or Centene.com. to look at these plans and the summary of benefits, right? You're also going to have on your screen the Ascend enrollment form that you're filling in, right? When you're doing your enrollment, okay? You may have Google up, right? So to have your script accessible to you, print it out, have it right on top of your desk or your workspace, all right? Number one here in our commandments is, of course, our introduction, which you'll find in section A1 of the Outbound Script, all right? Or A2, okay? Commandment number 2, credibility questions. That's where you are, of course, building some trust with those credibility questions. And in that, you can definitely make a friend. We're not saying, okay, memorize the script, stick to the script, and don't add your personality. Of course, familiarize yourself with the script, know the steps that you need to take in the sales process, don't skip any. And then, of course, add your own personality. Treat people like people, be human, right? Number 3, we have our fact-finding questions, which you'll find in section D1 through E1. 4, you're going to be looking up doctors and prescriptions, all right? And this step always take place. You do not omit this step, okay? I had someone tell me before that, I don't need to do prescriptions because these are WellCare PDP members and it's the same prescriptions that WellCare covers. So I don't need to look up the prescriptions because they're going to be covered the same way. That's totally false. Okay. You're always getting a list of prescriptions. Okay. Simply because the MAPD plan has a different formulary than the standalone PDP plan or prescription drug plan, right? So you are always getting a list of their current prescriptions. And with that, of course, the doctors, you're always getting a list of their first and foremost primary care physician and any specialist that they see, okay? I also had someone tell me, I'm doing a PPO plan. They have that luxury of going out of network. So, looking up specialists, I don't have to do that. That's false. To be compliant with Medicare, you have to look up every single doctor that they're seeing to see if they are in the network, especially if you're doing a HMO plan. Okay. And even with the PPO plan, you have to look up doctors because of the cost sharing, right? There's different costs if they go out of network as opposed to in network. Okay. So do the due diligence of always doing step 4 in the 10 commandments. Okay. And you'll find that in E2 through E3 of our Outbound Script. Number 5 commandment, teasers. Teasers are state specific. So, always the area that you're licensing and working in and those leads that are popping up on 5-9 for you, those calls that are coming in, familiarize yourself, just take a look at the summary of benefits, right? Don't wait till the last minute or wait till you're on these calls to now go to the summary of benefits. You want to master your craft. Take a look at them. I'm not saying commit them to memory, but just be familiar with them, right? The teasers, specifically hearing, dental, vision, personal emergency response system, meals, if there's meals in the plan, transportation, gym membership, right? Flex card, over-the-counter benefit. Okay, so those are teasers, considered teasers, all those ancillary benefits that they do not get with regular or original Medicare. Okay. So the teasers, you just become familiar with them, and that you can do either on Centene.com or wellcare.com by bringing up the summary of benefits in the states that you're working in or licensed in. Okay. Of course, the summary of benefits is something that you will eventually memorize because you're working in these areas, but that comes along with time. So don't be too hard on yourself with that. All right. Commandment number 6, you're calling SPOP, our special populations line, where you are going to find out, okay, what this person has. Okay, so you can be talking to someone, and as we know, Medicare is super confusing, and most people don't know what they have. That's the reality of it. Okay, that's where you're going to find out if they, in fact, have Medicare Parts A and B. You're going to find out if they have Medicaid, what level Medicaid they have. And you're also going to find out if they have a low income subsidy that helps with their prescription drug cost. Okay. So it's just like a confirmation call, right? Meanwhile, you are asking them these questions, and you as the expert, you're going to know what questions to ask to find out if in fact they have some sort of low income subsidy or Medicaid in place and things of that nature. However, this is where you confirm that in fact they have that. This call is also what we use as a takeaway, right? And I always say, if you have not built a strong enough need, or you have not created a need or found a need, there is no need, figuratively and literally, to call SPOP. Okay, you're not just calling SPOP for fun or just for something to do. Okay, you've already created a need, and now you're going to take this away. You got them all hyped up about these benefits, right? And now, Mrs. Jones, I have to see if you qualify. Okay, the next step here, I'm going to call in and see what you actually have in place. You did mention you had Medicaid through the state. Okay, and I need to check your level of eligibility with Medicaid to see if you actually qualify for these benefits. All right. So as we know, if you've sold Medicare Advantage before, or even if you haven't, right? First and foremost, the person has to have Medicare Parts A and Medicare Part B. Okay, A is going to cover their hospitalization, and Part B is going to cover their medical visits. So before we go any further, they have to have Medicare Parts A and B. We also refer to it as original Medicare. Okay, so what I'm going to ask you to do, everyone, once you get off, the first thing you want to do is Google what the Medicare card looks like, right? You want to know these things. You're the expert here, right? You want to know how it looked. Remember, people don't know what they actually have in place. So describing the card to them usually helps. Mrs. Jones, I need you to grab your red, white, and blue Medicare card, right? On the top of that card, Mrs. Jones, it's going to say Medicare health insurance, okay? And then it's going to list your name, your first name, your middle initial, and your last name. Right under that is going to be your Medicare ID number. That's going to be a series of letters and numbers. I need you to read that off to me to see if you're eligible. Okay. Also, in becoming a master of your craft, you want to Google what Medicaid is in the state that you're working. Okay, be familiar with what they refer to Medicaid as. For instance, I know in South Carolina, they call Medicaid Healthy Connections. If you're working in Maine, you know that Medicaid through the state is referred to as Maine Care, right? Here in New Jersey, most people know it as New Jersey Family Care. Okay. And of course, in like Tennessee and stuff like that, we know it's TennCare. And so become familiar with what they refer to Medicaid as. Again, and I'll repeat this, most people don't know what they have. What our job here is to make Medicare as simple as possible and make it as exciting as possible with all these ancillary benefits that they can perhaps be eligible for, right? As you see here, I've been using the word qualify and eligible. Those are two key words that you want to use throughout your presentation. okay? Because the fact is, everyone wants to qualify or be eligible for something, right? You want to put it in your mind that we're not just giving these benefits to everyone, right? You want to take it away a little bit. You know, this is exclusively for people that qualify. These are the benefits that you can get. Okay. Another thing in mastering your craft, you want to know that original Medicare only covers 80% of their medical expenses. The other 20%, they are responsible for. Okay. So our job is to look to cover that, help cover that 20%, and also give them some extra benefits here. Dental, vision, hearing, right? Over-the-counter benefit, right? Most people are going to say to you, I have Medicaid, I have everything I need. Mastering your craft, we know Medicaid does not give an over-the-counter benefit. We know that people on Medicaid, they're on a fixed income. So that over-the-counter benefit will help save them money and put that money back into their pocket on those multivitamins that they're spending their cash on, right? We know that Medicaid is not going to give them a flex card, a visa, to spend on dental, vision, and hearing benefits if they come up short, right? So that's going back to mastering your craft. Another thing that I want to mention before I move forward, people may have something else in place to cover the 20%, things like a Medicare supplement plan or VA benefits, right? Your presentation doesn't stop there. We can possibly help them, okay? And I will always say most people don't know what they have. So they probably got into a Medicare supplement plan just thinking that was the only option for them, not knowing there's another option of a Medicare Advantage plan that will help cover the 20% and also give them some benefits that the Medicare supplement plan doesn't cover. Okay. So never get intimidated by other coverage unless it's like employer group benefits and stuff like that, where, you know, there is a possibility that, you know, certain things aren't they can't get back into the benefits if they cancel them. All right. So Medicare Advantage may be for a lot of people, but again, going back to being the expert and knowing who you're talking to and finding out their need and things of that nature. All right. So going back to our 10 commandments, calling SPOP, which you can find in section F1. Okay. When you come back from SPOP, 99.9% of the time, if you've done everything correctly and you went through these 10 commandments and you're going through the 4 steps of the sales process with making a friend, building trust, finding or creating a need, you should be closing when you come back from the SPOP call. Okay, you should be closing. You should know that you have a sale. The only way you're not going to have a sale is if you found out on the SPOP call that they don't have Part A, for instance, right? Or even they have Part A or they don't have Part B. Can't move forward, right?
Nicole, can I ask a question? Or do you want to just keep going?
No, you can ask a question. Go ahead.
What's your take on using Ascend to check, you know, they've got their Medicare number, they've got their Medicaid number, and just you've got them on the phone, you just do it in Ascend. What's your take on doing it that way?
You can use Ascend, but I would not suggest solely relying on Ascend. Okay. I would definitely call into SPOP. It takes about 5 minutes to call into SPOP. If you have reservations about calling SPOP and the time that it takes, and in fact, it, you know, having an effect on losing the sale, that means you never had the sale to begin with. Okay, so calling SPOP is one of the 10 commandments, and I'm going to say I totally believe in calling SPOP. I use it as a takeaway. You can use Ascend, but I would not eliminate the SPOP call.
Thanks.
Okay, it just builds anticipation. it does so much. I mean, we can just say, oh, number 6, call SPOP, but it serves as so much, building that anticipation. Oh my God, I'm on the other line. These benefits sound so great. I don't know if I qualify. Oh my God, please just come back and say I qualify, right? With a send, you're just like, okay, yeah, you got part A and part B. Okay, great. Now,
I guess the only I might add
Nope.
to support your comment, it can,
Yes.
you know, if I've got them on the line, it can help sort of legitimize, you know, who you are as well.
Your
because they're-
credibility.
Right. So
Absolutely.
I'm just curious.
Absolutely. It does help with credibility. All right. Number 7, which you'll find in section F2, you're doing a full plan presentation when you come back. So every single bullet point, which we'll go over in section F2, you're hitting every single bullet point there, right? Number 8, you're going to ask for the sale and a callback. I know it says ask for the sale here. However, the mindset is assume the sale, right? Assume that you have the sale and you're going to ask them for a callback. Number 9, you're going to explain what's going to happen. That you'll find in the bridge statement, which we'll go over. And number 10, you're going to follow the full compliance script for enrollment, and you're going to give a confirmation number. And right after that, you're doing a health risk assessment. Okay, so those are the steps. And right now we'll go right into our inbound script. So if you can, go to the div.com/telesales, have that printed out. For purposes of following along, you can have it on your screen now if you don't have access to a printer, but yes, everyone should have the outbound script up on their screen. All right, again, the scripts can be found under important resources on the div.com/telesales. All right. So going right into our outbound script. All right, again, it's all color coordinated. Okay, I know it looks overwhelming. However, every part here you're not going over. Most of it you are, but you know, it's going to give you directions based on the colors of where you go, the answers that you receive from the beneficiary, etc. So I'm going to say we're talking to a PDP member, WellCare PDP member. Most of your leads will be a PDP member. Some of your leads are BRCs. If you see there in the column right next to that, if it's a BRC, that's where you're starting. But in most cases, you'll be starting if PDP member, section A2. All right, so if I have everyone with me. Hi, Mrs. Jones, this is Nicole Moore. I'm calling you on behalf of WellCare. We are your Part D prescription plan provider. The reason for my call today is that WellCare has asked me to reach out to some members in the Essex County area, just to see if we can help them and to make sure they're receiving all of the benefits they may be entitled to with their WellCare plan. Now, what we found is that many of our Part D only members, they may not be taking advantage of all the benefits that WellCare has to offer. So I'm actually calling you with some good news today. That's a nice change, isn't it? Right? So with that, you always want to mention that you are calling on behalf of WellCare, their Part D prescription plan provider. Now, I'm going to be totally transparent with you. Most people may not hear your introduction when you first get them on the line. Okay. Why? Because it's AEP time, right? Most people are looking at these commercials, and with looking at these commercials, they're receiving a ton of calls already, right? From other companies. So they're inundated with all these calls from telemarketers, and they just assume that you're also a telemarketer. How do you set yourself apart from that? Mrs. Jones, no. I'm calling on behalf of WellCare, you know, your Part D prescription plan provider. okay? The card that you bring to the pharmacy to fill your prescriptions with, okay? You want to let them know that we already have a relationship with you. And even if you want to say, Mrs. Jones, I am not a telemarketer, okay? Again, I am calling on behalf of WellCare, your Part D prescription plan provider. Okay, so even if you have to repeat your introduction, it doesn't take any time to do so. And I just want to give you heads up. Most people aren't going to hear your introduction, right? They're going to just be like, oh, okay, I got to get off the phone. Another telemarketer, I can't deal with this. No, I'm not a telemarketer, right? And even if someone hangs up on you, you are calling them right back. Most telemarketers don't have the capacity to call right back, right? So you call them right back. A hang up should never intimidate you. You're going to call right back and make it clear, hey, we have a relationship already. I'm not a telemarketer. Okay. So after your introduction, you're going into some credibility here, right? Is your address still 123 Main Street in Bloomfield, New Jersey? Okay, I have here your zip code is 07003, or however you do that. But all this information will be on your screen, okay, for you to verify. All right. Okay, great. Some of the enhancement benefits I was referring to before at no cost to you at all are things like free over-the-counter items, hearing, dental, or even vision benefits. WellCare also offers an individualized care plan that many members find helpful. Is now a good time to go through this. So something I want to mention here, okay? I want to go back to at no cost to you at all, right? You want to refrain from saying free benefits or free plan. We have a free plan for you. Yeah, it's at no cost. Okay, so do not say we have free benefits, we have a free plan, things of that nature. You want to refrain from using those words. It's at no cost or a zero premium plan. All right. Now, getting to the bottom of A2 here, it says, is now a good time to go through this with you? I've never asked that question. Okay, so I'm going to make a suggestion that you omit that question unless it's really, you can hear that it's really not a good time. I want you to assume it's always a good time when someone answers the phone. Okay, if they had time to answer, because when it's not a good time for me, I'm not picking up the phone. It's the least of my worries, right? So we're going to always assume it's a good time. Okay, and we're not going to initiate is now a good time. Let them tell you it's not a good time. You don't initiate it. You assume it's a good time and you move forward with your presentation. All right. Now, aside from that, if you hear a lot of things going on in the background, they're at a doctor's office, pharmacy, whatever the case is, you'll be able to judge that, right? And at that point in time, you can say, Mrs. Jones, I hear a lot going on. I need your undivided attention. Is there a better time or, to reach out to you? Okay. Or that's when you can ask, is now a good time? Okay. But don't initiate it up front. Okay. And when you're setting up another time to give them a call back, you always offer 2 options for them to choose from. Okay, for example, Mrs. Jones, I hear a lot going on there with you. I take it now it's not a good time for you. Is that right? Okay. I'm going to need your undivided attention for this. There's some benefits that you may be entitled to at this point in time. When is a better time to reach you? Would later on this afternoon be better for you, or would tomorrow morning be a great time? Okay, so you always offer 2 times. Okay, tomorrow morning is better. Is 9 a.m. good for you, or would 10 a.m. be better? okay? You don't want to get into the habit of saying, can I call you back later on? No. Oh, how about tomorrow morning? No, that's not good either. Oh, well, what about tomorrow afternoon? It's just not going to work. You're going to be begging for a time slot at that point. Your mindset should be, this is very important information, okay? I set aside this time for you. My time is very valuable. Your time is very valuable. These are benefits that you're missing out on, and it's my job to let you know about them and get them set up for you, okay? So you're not negotiating, time and things of that nature, or even begging for time. All right. This is something that needs to be done. I'm calling on behalf of your prescription plan provider, WellCare, and this has to be done, right? It's mandatory, right? It's very important. Okay. Would morning or afternoon be good? Okay, afternoon. Is 12 noon good for you, or would 2 o'clock be better? All right. Moving along to A3. Great. I'll need to ask a few questions to determine your eligibility. You will not have to provide any health-related information unless it's used to determine your eligibility to enroll. Now, all of our calls are recorded and monitored for quality assurance. May I have your permission to record and monitor this call? Right below that, if they say yes, you're going to continue to step C1. If they say no, then you're saying, I'm sorry, but we are required to monitor and record all calls for quality assurance. Do you wish to continue? I'm going to tell you, most people do not say no, okay? Right? Because, they have the security. The security is for them. We want to make sure everything is above board here. All of our calls are monitored and recorded. No one usually objects to that. All right. So we're going to assume they say yes here, and we're going to go right down to step C1, right? We will be discussing Medicare Advantage plan options today. Will this be for you or someone else? All right, so that's where you're going to find out if you're speaking to an authorized representative, a spouse, a daughter or son, a legal power of attorney. All right. Let's say it's for the person that you're speaking to, the beneficiary that's listed on the lead on your screen. Okay, you're going to go right to C2. If we get disconnected, may I have your permission to call you back? They say yes. What is the best number to reach you at? Or you can just verify the number on the screen that you just called. All right. You're going right down to D1. And I know it says here, may I please have your zip code and county in order to pull up Medicare Advantage plans that are available in your service, but you're going to have their zip code right on your screen. So you're just verifying that and making that one of your, credibility questions. All right. So you're just verifying their zip code. I have here, Mrs. Jones, your zip code is 07003. Is that still current? You want to confirm the zip code. You want to confirm the county. Because remember, there are instances where a zip code lies on the border or in two different counties. So you want to confirm their zip code and in fact, the county that they reside in, okay? Because that will determine if there are plans available in that area, okay? You can have someone with the zip code of, I don't know, let's say, Bloomfield had more than one zip code, 07003, but it could be in Essex County or Union County. I know that's far-fetched, but you get the idea where a zip code can lie in two counties. So you want to verify which county it is to see if there's plans available in the area. All right. Going back to D1, so you're bringing up plans. I see we have a Medicare Advantage plan that offers medical benefits, which may include prescription drug coverage. Most of the plans do include prescription drug coverage. And also, if you are speaking to a WellCare PDP member, you are signing them up with a MAPD plan in their area, simply because you don't want to leave them without prescription drug coverage. Okay. You don't want to take them from their standalone prescription drug plan that's covering all their prescriptions and things of that nature, doing so well for them, to give them a MA only plan with no prescription drug coverage. So MAPD, that's the way we go. D2, do you have Medicare Parts A and B? Right. D3, if they don't have it, will they be eligible for Medicare Parts A and B within the next 3 months? Most people have A and B. D4, if you're talking to a WellCare PDP member, of course, we're skipping that because we know they have a prescription drug plan at this point. All right. So there's no need to ask, do you currently have a prescription drug plan? You can go right to D5. Do you currently have Medicaid or extra help? Okay. Medicaid is through the state. Extra help helps with prescription drug costs. Okay. You'll hear LIS, which stands for low income subsidy. But yes, this is where I'm saying, become familiar with Medicaid and what they refer to it as in their state. Okay. Mrs. Jones, do you have a green and white card that says TennCare at the top? That's their Medicaid in Tennessee. Okay. Most people don't know the word Medicaid. That's not what they refer to it as. Right? Master your craft. Extra help, again, LIS, low income subsidy, helps with specifically with prescription drug cost. All right. One thing I want to mention, if you are accustomed to using acronyms or what I refer to as agent jargon in your presentation, okay, it's okay to do. But if you're going to use an acronym like LIS, you want to follow it up with a brief description. Make it simple. Remember, our job is to make Medicare simple and make it fun and exciting, right? So, Mrs. Jones, do you have extra help? They refer to it as LIS. What that is a low income subsidy that helps with your prescription drug costs, right? I have some questions in D5. I have some questions that will help me understand the coverage you might have. And that's where you're going through if they have TRICARE, veterans benefits, if they have employer group coverage in D8. Okay. Since most of you are going to be going full force in the AEP or annual enrollment period, this next part here in D9, it says, since we are currently outside the annual enrollment period, which runs from October 15th to December 7th each year, we will need to have a special election period in order to qualify you for one of our plans. Each of the questions I ask will help determine if you qualify for an SEP, special election period, right? Everyone that's on the phone now, my inside telesales group, they have to say this right now, okay? Because of course we're outside of the annual enrollment period, right? And right now people have to qualify for a Medicare Advantage plan by having a special election period, okay? That special election period can be they're new to Medicare. That special election period can be they have a low income subsidy, or they have both Medicare and Medicaid, right? That's what's qualifying people right now and actually enabling us to sell all year round, okay? Most agents, a lot of agents, they only sell during the AEP period. That's what sets us apart. And we are a 12-month operation. Okay, we're able to sell Medicare Advantage all year round. Okay, but starting in AEP, you do not have to ask all those questions or even try to find out what their special election period is, because they don't need a special election period starting October 15th, right? So we can skip over that section. Of course, after AEP, you can come back for another training or call me up and we can go over, even on that 6:30 Wednesday call, they go over, you know, we're now outside of AEP. This is what you're going to do. You're going to be going back to those questions, okay, to determine their eligibility. All right. So as you see here, moving right along, since we're skipping that now because annual enrollment, comes in E1, the needs analysis. This is where you're going to find out about what they have in place, the coverage that they have in place, what they're lacking in the coverage, what they don't like about the coverage, what they wish to see in the coverage. So this is where you're going to do your needs analysis. Okay. And when I say do a needs analysis, I don't mean saying, so Mrs. Jones, what do you need? You're an expert. You don't handle it like that, right? There's going to be questions that you ask, like, you know, when you go see your doctor, how is it in the office there? Do you like your doctor? Do you have a long relationship with your doctor? The plan that you have right now, that plan that you have right now, are you getting an over-the-counter benefit? If someone says, oh, I don't know, or what's an over-the-counter benefit, it's go time for you, right? Whether they have a plan or not, it's go time for you because they don't know what's in their other plan. That means they didn't get with that other plan what you have to offer, which is yourself. You are going to be their advocate. By the time they get off the phone with you and you do the enrollment and everything like that, they're going to know from your presentation what they have in their plan, right? So you're finding out, do you have any, what are you doing for dental, Mrs. Jones? When was the last time you've been to the dentist? Okay. Are you wearing glasses? Oh, I know those can be very expensive. I wear glasses myself. Did you have to pay out of pocket for your glasses? Right? So now you're finding or creating a need, right? You're creating a need that they didn't even know they had. But this is the part where you're going to do that. Okay, so in E1, we have questions like, what type of plan do you currently have? What do you like about your current plan? What would you like to change? What is most important to you? What additional benefits would you like to have that you don't currently have? Okay, so yes, you can stick to these questions, but being an expert, you know, like what question, there's other questions to ask to kind of do like a process of elimination where, okay, I know this person doesn't have dental. I know that they want dental. So that's going to be a selling point for me. Okay. In this needs analysis, you're having a conversation. All right. I know it seems here and it's set up like an interrogation, but no, you're having a conversation with them. Okay. In having the conversation, you are that person will tell you how to sell them. All right. Most people, if you listen, they will tell you how to sell them. Okay. These questions here, I always say you got to ask more questions simply because most people don't know what they have. You have to find out what they have. Make it simple, right? And I'll show you a way that I do that and how I usually handle sections. I'm going to say from the beginning to E1, right? So I just make it a general conversation with them, right? So I call in. Hi, Barbara. Hi, this is Nicole Moore. I'm calling on behalf of WellCare, your Part D prescription plan provider. How are you today? Okay, great. Now, the reason for my call today is that WellCare just asked me to reach out to some of our members here in Essex County, just to see if we can help them and to make sure they're receiving all of the benefits that they're entitled to with their Medicare, with their WellCare plan. All right. What we're finding right now is that many of our Part D only members, they may not be taking advantage of all the benefits that WellCare has to offer. Okay, so I'm actually giving you a call today with some good news. All right. Now, before I get into anything here, I just have to let you know that this call is being monitored and recorded for quality assurance. Do I have your permission to monitor and record this call? Okay, great. Now, before I fill you in on these benefits here, I just need to confirm what's up on my screen. I have you at 123 Main Street. That's in Bloomfield, New Jersey. Is that correct? Okay, and your zip code here is 07003. Is that still current? Okay, great. And you're in Essex County, right, Barbara? Okay, great, great. Now, it says here you have Medicare Parts A and B. Is that still current? Okay, I have to let you know, on your screen, it does not say whether they have Medicare Parts A and B. All right, you're going in with the mindset that you're speaking to everyone that you speak to has Medicare Parts A and B. Okay, go in with the mindset, and if they don't have Medicare Parts A and B, or one and not the other, okay, that's the worst that can happen, right? But how you're going to approach it, you're going to make it one of the credibility questions. Pretend that it's on your screen. I'm saying pretend, not lie, right? Just pretend it's on your screen and make it one of the confirmation questions. Like, I'm seeing here on my screen that you have Medicare Parts A and B. Is that still current? That's where you're going to find out if, in fact, they have original Medicare. Okay. Now, Barbara, are you on Medicaid through the state, or what they refer to? I'm sorry, if everyone can just mute, that would be great. Unless someone has a question. Does someone have a question? Okay, awesome. All right. So now, Barbara, do you have Medicaid through the state as well, or New Jersey Family Care? Do you have a card like that you bring to the doctor? Okay, great. Now, when you go see your doctor, you pay nothing to see them, right? Okay, great. That's how it should be. Now, when you go to the pharmacy, you either pay nothing at all or between like $1 and change and $3, right? And that's where you find out if they have extra help, LIS, Medicaid, right? Now, are you using any other insurance company besides your Medicare and New Jersey Family Care when you go and see your doctor? That's where you're going to find out if they have veterans benefits or some type of dental plan with an old employer or anything like that. All right. Okay, so it does sound like you are entitled to those additional Medicare benefits. What I need you to know, Barbara, is that this is funded through both Medicare and Medicaid, so it comes at no cost to you. Okay, there's no monthly premiums, nothing like that. This program, it's actually through WellCare. Okay, it's a company that you are already familiar with. All right, and then you're going to go into, of course, fact-finding questions, right? Are you a resident of a long-term care facility or a nursing facility? Those are things that you need to know, all right? Do you have employer group coverage? Do you have TRICARE? Do you have VA benefits? Things like that, fact-finding. All right, now we're down to commandment number 4, where we are looking up doctors. Do you have a specific primary care physician that you would like to keep? All right, this is where you will determine who their primary care physician is. If their primary care physician is not a network, you will help them choose another one. okay, if that's an option. And you will establish who the new one is going to be if their current one is not in network. Right? So that you'll find in E2, E3. This is where you're getting their prescriptions. In order to find the right plan, would you be willing to give me the name and dosage of the prescription drugs you take so I can let you know how much they would cost you on the available plan? Okay, so I know that's stated on the script. This is a Medicare compliance script approved through CMS. You have to ask about their prescriptions. You have to get a list of their current prescriptions. So how I usually do that is, Mrs. Jones, what I'm going to have you do is just grab a list of your prescriptions, the current prescriptions that you're taking, and I just need you to read those off for me. Okay, so I kind of do it as this is the next step in the process, right? I don't ask if they would mind giving me their current prescriptions. No, this is the next step, right? You want these benefits. This is the next step here. Okay. So can you just go grab your list of your prescriptions, and I get a list of those. And then we're moving into F1. Okay, in section F1, again, commandment number 6, this is where we're calling into SPOP, or that special populations line. Okay. So you mentioned earlier that you have Medicaid. In order for me to determine if you're eligible for one of our special needs plans, I'll need to verify your Medicaid level with WellCare. Okay. And I want to stop there. Okay. So I know a question in your mind is, well, what if they didn't say they have Medicaid? What do I say then? It doesn't change. Just stick in there. Okay. You told me earlier that you have Medicare Parts A and B. Okay. What I need to do here is check your level of Medicare. Okay. Just to see if you qualify for one of the plans, or to see if you qualify for the extra benefits that we spoke about. All right. Next part here, it says, may I please have your Medicaid ID, date of birth, and Medicare ID number. I'm going to strongly advise you and suggest that you do not ask for their Medicare information that way, or their Medicaid information that way. Okay. Never ask for permission where you have authority. Okay. You have authority in this. You're the expert. You don't have to ask permission to do your job or to help them out. You know they need the help, right? So never ask for permission where you have authority. Mrs. Jones, the next step here is for you to grab your Medicare card, the red, white, and blue card. Okay, on that card, there's a series of letters and numbers. Whenever you're ready, I need you to read that off to me. Okay. What I'm going to do, I'm going to call in to another division here. I'm going to check your level of Medicaid, or I'm going to check your level of Medicare. Okay, it's going to take about 5 minutes. I'm going to place you on a brief hold, and I'll be back on the line to let you know the status. All right, it's that simple. Do not make a big deal about them getting that information to you. Okay, there's nothing sacred about this. There's nothing, you know. I know there may be some people that object and say, well, no, I can't give you that information. I was told not to give that information out over the phone. What that means is either one, it's a smokescreen. Number two, you miss something in the steps. You did not make a friend. You did not build any trust. Okay. If you are not getting the Medicare number easily, that simply means you need to back up and start the process again. Okay. Because what that tells me is that you've missed either making a friend, and most importantly, building some trust. They don't trust you. Okay. Also, never make a big deal about asking for that number. There's nothing you can do with that number but check their level of eligibility for these benefits or pay a medical claim. Okay, Medicare changed the number from their Social Security number on purpose to this series of letters and numbers to protect their social. Okay, so, and you can make that clear, a couple of years ago, Medicare changed the number, Mrs. Jones, from your Social Security number to now a series of letters and numbers. There's nothing that can be done with your number except, pay one of your medical claims or check your level of eligibility, okay, for any additional benefits that you may qualify for. Okay, so whenever you're ready, just read that number right off to me. All right, so you call into SPOP. What you're going to need for the SPOP call, okay, they're going to ask you what your name is as the agent, and you're going to need your WellCare ID number. All right, so you're going to give them your WellCare ID number, and what you're going to say is, I want a full verification for the state of wherever that beneficiary resides. Okay, I need a full verification for the state of South Carolina, for instance. All right. After that, you're going to give the beneficiary's first and last name. You're going to give their Medicare ID number and their date of birth. Okay. If the date of birth is not on the screen for you, which I believe it is, but if it's not there, no worries. Mrs. Jones, can you just confirm your date of birth here? Act like it's on the screen. They don't know, right? Mrs. Jones, I mean, how many times have you been on the phone and like you may call into your, let's say your cell phone company. The first thing they're going to say, I need to verify who you are, because I'm not going to be, or the conversation won't even go further. So make it one of those questions where you're like, Mrs. Jones, can you just confirm your date of birth? In order to move forward, they need to do that, just to verify that you're actually the person that I'm checking eligibility for. All right. So you made that SPOP call. SPOP is going to come back and say, okay, this beneficiary has Medicare Parts A, effective 1/1 of 1956, and their Part B is effective 1/1 of 1956. All right. They also have LIS at level 1 at 100%. Okay, that's a low income subsidy at a level 1 at 100%. Right. That simply means they have extra help paying for their prescription drug costs. Okay. Then they're going to place you on another hold. At that point in time, you're going to check back in with your beneficiary. Mrs. Jones, just a little bit longer here. I'm just finding out your eligibility on Medicaid. But good news, you have Medicare Parts A and B, that was confirmed. And you also have what's called a low income subsidy. I'm not sure if you were aware of that. That's to help out with your prescription drug costs. All right, so just a couple more minutes here and I'll be back on the line to let you know the status. Another takeaway. Oh my God. Okay, yes, I'm halfway there, right? All right, and then when you go back to SPOP, if you choose to do it that way, you can just stay on for the full 5 minutes without checking in, that's fine. But if it goes over 5 minutes, which you promised, right, you always check back in with the beneficiary to let them know what's going on, right? So at that point, SPOP is going to come back on and let you know their level of Medicaid. This member has a Medicaid level of FBDE, which indicates they have full Medicaid, right? And they qualify for the Liberty plan. Okay, now, Mr. Loud spoke earlier about using Ascend. Yes, you can use the Ascend for this. However, just like we can't solely rely on Ascend, we can't solely rely on what this representative at SPOP is telling us about what plan they qualify for. They're just reading what's on their screen. You as the expert who's licensed in this state, is going to go by what's stated in the summary of benefits for that plan. So if you don't see FBDE in the summary of benefits for the plan that you're about to pitch to them, right? Okay, yeah, SPOP, they just, read, but yes, you want to go by, of course, what SPOP is saying, the level of Medicaid, okay? But you yourself as the expert who's licensed, as opposed to the representative that you're speaking to, you're going to look to see what dual special needs plan they qualify for, or DSNP plan they qualify for, with their level, okay? That you can find at the beginning of every summary of benefits for dual special needs plans. Okay, also with a brief explanation of what their level of Medicaid covers. All right, so you come back from SPOP and you're excited. You should be excited, or you should sound excited, okay? Because I'm telling you right now, that excitement will be reciprocated on the other end of the phone. So you want to definitely deliver a tone that, this is great news. Mrs. Jones, I have some great news for you, okay? You definitely qualify for the benefits that we spoke about, okay? I'm gonna go ahead and go over some specifics with you on what you qualify for in the plan, all right? And if you have any questions, you can stop me along the way and ask me, all right? And that's where you're going right into F2. Every single bullet here, you're going to go over, okay? You cannot skip F2, okay? You need to go over this information on the plan. All of this information can be found in the summary of benefits, okay? And you're hitting all those benefits, all right? Even if you're doing a dual special needs plan and the entire summary of benefits states a bunch of zeros, okay, you're still going over the bullets. Mrs. Jones, your monthly premium for this plan is $0. Your medical deductible, there isn't a medical deductible on this plan. When you go see your primary care physician, it's a $0 copay. If you go to any of your specialists, like your cardiologist or your neurologist, it's also a $0 copay, okay? God forbid if you ever went into the hospital, inpatient hospitalization is $0 copay. For outpatient, it's also $0 copay, right? Emergency room, if you ever went into the emergency room, God forbid, right? It's a $0 copay for you with this plan, right? If you happen to not want to go to the emergency room and Mrs. Jones, you want to go to the urgent care, that's also a $0 copay. The maximum out of pocket on this plan is $3,400 for the year. Okay, what that does is put a cap on anything that you can be charged in regards to your medical bills out of pocket cost, right? It puts a cap on it. It's your protection, basically, right? But being that you have Medicaid, Mrs. Jones, more than likely any out of pocket will be covered. Okay, and then you're going to get down to your PDP bullets: prescription deductible, prescription drug coverage, all tiers based on the prescriptions that they gave you. So Mrs. Jones, your amlodipine is covered on tier 1, okay? If you get a 90-day supply, it will cost you this, so forth, right? Donut hole and coverage gap, catastrophic phase, right? So you went over F2, you went over all the benefits in the plan, those bullet points there, and you're moving right into G1. I'm going to suggest that you do not change anything in G1, okay? It's just a perfect transition from now we're getting down to an enrollment, right? It's a perfect transition from, okay, we're going to this point where, you've made a friend, you built trust, you had some conversation, you enjoyed each other, you talked about the dog, you talked about the grandkids, you gave them the great news on even qualifying for these benefits. And now we're getting to the more formal part. Okay, so it's a great transition in G1. We have now completed the overview of the Liberty plan or WellCare plan. You're using the plan name, the WellCare plan available to you, right? Do you have any questions, or would you like for me to review anything regarding this plan or any other benefits before you enroll today? Okay. No questions. You're moving to G2. In G2, I want you to note here, it says, would you like to proceed with completing an enrollment? Which plan are you interested in enrolling? What I'm going to ask everyone on this call to do is omit that section, put an X through it. You are not saying that. Why? Because you already asked them this. There's no need to bring it up again. And now they're thinking, well, maybe I shouldn't enroll. No, you're enrolling. Remember what I said, after SPOP, you know there's an enrollment coming up. That's the mindset that you have to have. If there is not an enrollment coming up, that simply means you missed a step and you need to go back and start again. All right. But at this point, we already assumed the sale, right? 10 Commandment, Commandment number 8, right? Commandment number 8, you assume the sale, and now you're getting to your callback. So omit G2 and go right to G3. Do not change anything here. Okay, do not change anything in G3. At this point, I have all the information that I need to begin the enrollment process. Mrs. Jones, during the enrollment process, some of the information that I'm going to review with you may be similar to what we've already discussed. I want to make sure that I've captured all of your information correctly so that your enrollment into the WellCare Liberty Plan is completed accurately, just to make sure we don't have any disruptions in your coverage. All right. Now, Mrs. Jones, the laws that govern Medicare requires that enrollments be completed on incoming calls only. And since I called you today, what I need you to do is give me a call back on the enrollment line. Okay, that's going to be a recorded line. Again, it's for your security. Okay, I'm going to take your enrollment on that line and you'll have your benefits by January 1st if you're selling during AEP. All right. So I know it says, would you mind calling me back so that we can complete the enrollment? I'm going to ask you to change that to the next step here. What you're going to do is call me back, right? Never ask for permission where you have authority. You've already assumed the sale, it's going down, there's an enrollment happening, and now you're just giving them the next step in the process. What you're going to do here, you're going to give me a call back, and you're going to give them the number to call you back on. All right. The number that's listed there is not the number that they're going to call, so I need you to make note of this. The number that they're going to call is 1-844-244-8000. Again, it's 844-244-8000. And then you're going to be assigned an extension that you're going to give so they go right to you, as opposed to our recording that we have set up. So they're going to dial your 3-digit extension and get right back to you. All right. So Mrs. Jones, my number is 844-244-8000. Okay. My extension is 834. You're going to give me a call right back. I'm going to take your enrollment and you're going to have your benefits for January 1st. All right. I'll talk to you. I'll talk to you soon. All right. Again, you are not saying, would you mind calling me back? You have to make this, it's a sense of urgency that you're creating. In order to get these benefits that we know that we just found out you qualify for, the next step here is to call me back at this number. It's a recorded line. It's the enrollment line. You can say, this is the enrollment line. Again, it's a recorded line. It's for your security on that line because Medicare deems it, that everyone needs to be on an incoming call only. Okay, just make that clear. All right. Any questions on the outbound script before we move along?
I have a quick question.
Sure.
When we call SPOP, you mentioned after you received all the information, you now change the name of the plan. So when you get verification from SPOP, is that when they tell you what the name of the plan they can be enrolled in is called? Because then you said Liberty. You said WellCare Liberty. So is that a certain plan name?
Yes, and you'll find that out during like products and stuff like that, like a product training where, you know, most people, and what WellCare did, they made all their plans across the board, no matter what state you're living in, they made it the same name now. So for instance, if you work with dual special needs plans, you kind of know in WellCare that their most generous plan for a dual special needs eligible, right, is going to be their Liberty plan, as opposed to their access plan for the other levels of Medicaid. So, you know, for instance, like a full Medicaid eligible person is going to go in a Liberty plan, right? But what if someone is fully Medicaid eligible, right? On SPOP, what they're going to say to you, okay, because they're reading from a screen, this person level of Medicaid is FBDE, right? They qualify for the Liberty plan or the access. As the agent, you're going to pick which one based on what, because you're the expert, you're going to say, okay, if they qualify for the Liberty plan, I know that's the most generous one. I'm putting them in the Liberty plan as opposed to the access. I know they said access, but you know, I know they get a little less than what's in the Liberty. I want to give them the best of the best if they qualify. So I'm going to go with Liberty, right? There may be instances, and I'm sorry that if I confused anyone, there may be instances where SPOP says, okay, they qualify for their level of Medicaid is FBDE, they qualify for the Liberty plan or access plan, but you as the agent knows there's no Liberty plan in the zip code, right? So you know that, yeah, they qualify for Liberty, but Liberty is not offered in the zip code where the beneficiary resides. So I have to go with access.
Okay.
Right?
Okay. Mm-hmm.
Okay. Any other question? That was a great question. Any other questions? Okay, so we can move right into the bridge statement. All right, this is something that I used to do before every single enrollment because, you know, after getting objection after objection, you know, I had to find a way to handle those objections up front. So the best way to handle an objection is before it comes up. Okay, I've been taught this, I've executed this, and it works, right? So because I was able to bump my head on all these objections and be in the middle of an enrollment and have someone stop me in the middle of an enrollment, I'm like, yo, I have to figure out a way to eliminate those objections during an enrollment where I'm reading a script, right? Verbatim, right? And I have to make sure they're clear on everything that's going to happen in this enrollment. Best way to handle it is before it comes up. So I put together this bridge statement, which is very successful here, and it should happen before you do any enrollment, right? Another thing, it should always happen on an inbound call. Do not go through the bridge statement on the outbound call. You don't want to overwhelm them, and then now they're like, maybe this is a long and drawn out process, and yeah, can we schedule this for another time? right? So you do the bridge statement once they give you a call back. Okay, so the bridge statement basically walks them through the entire enrollment process. It's going to tell them what their role is going to be during the enrollment process, and also what your role is going to be during the enrollment process. Okay, it's going to mention things that most people objected to before I constructed this bridge statement. All right, so it's going to handle everything for you. If done correctly, your enrollment will go very smooth. All right. So if you have that up on your screen, you can follow along. Now, Mrs. Jones, before I begin the enrollment, let me just explain how the enrollment process goes so you know what to expect. I'll start the recording by reintroducing myself. I'll let you know that the call is being monitored and recorded for quality assurance, and I'll ask for your permission to continue. Once you give me permission to continue, I'll ask you to confirm that you place the call in. I'll ask if you're completing this application for yourself or for someone else. You'll answer accordingly, and then I'll be asking a series of questions. These questions will determine why you are eligible for these benefits at this time of year. You'll answer yes or no to each question. Once we get to the question, do you have both Medicare and Medicaid, or whatever question they're answering yes to in order to determine an SEP, you'll answer yes, and this will enable me to move forward with the enrollment. Now, because we're starting, or most people on this call, they're not selling right now outside of annual enrollment period, that part is going to be omitted, okay, during the annual enrollment period, because they don't need to have a special election period in order to qualify for the plans. Okay, so starting October 15th, when you start enrolling people, you don't have to touch on the SEP part or the special election period part, or having to answer yes to that qualifying question. Okay. So you're going to skip over that for AEP. All right. And go right to, I'm going to be reading through a bunch of disclosures, some of which does not pertain to you. However, these disclosures have to be read on every single enrollment that I do. Okay, there's going to be something in there about a late enrollment penalty. Now, this is for people who did not enroll in a prescription plan at the time of enrolling in their Medicare Parts A and B. However, you've had your WellCare prescription plan. I'm also going to talk about a premium and ways to pay it. This is not applicable to you because this plan does not have a premium, right? Remember, it's a zero premium plan. Now, there are some plans that carry a small premium. All right. So in that, you are going to mention the premium, even if they have a level of LIS or low income subsidy that you know is going to cover the prescription drug part of the premium of this MAPD plan. Okay. If there is a premium listed in the summary of benefits, you have to mention that there is a premium. For instance, Mrs. Jones, there is a premium on the plan for $14.10. Okay. But remember, you have a low income subsidy at a level 1 at 100%. Okay. Therefore, the premium will zero out for you. Okay. And by default, the WellCare system will generate a coupon book for you that says $0 on it. So when we get to the part of the enrollment, please respond coupon book. Now, if there's something that I read that you quite don't understand, please feel free to stop me and we'll go over it. I'll conclude the recording with a confirmation number for you to write down and keep for your records, and you'll have your benefits by January 1st. Okay. So that's the bridge statement. Any questions on the bridge statement? I know it got confusing around the SEP part, but we're omitting the SEP part once we start selling for annual enrollment. Any questions on low income subsidy and things like that? And it's zeroing out the premium. So just so you know, there's different levels of low income subsidy or extra help that helps with prescription drug costs. It can be a level 1 at 100%. It's usually level 2 at 100%, level 3 at 100%. And then when it gets to level 4, it starts breaking down 100%, 75%, 50%, 25%. That's where you need to be concerned when it gets to that level 4, and what part of the drug prescription portion of the plan it will cover. Okay. And I can send you something that explains that from WellCare with their plans. I don't think we got the new one yet, but for the plans for the upcoming open annual enrollment. But yeah, just so you get a general idea of what that entails. Most likely, in most cases, it's going to zero out the premium based on what they have in place. All right, so moving right to the inbound script. This script, we cannot change. We cannot paraphrase it. We have to read this script verbatim. It's very important that you do not change anything here and that you're reading word for word, okay? You can let them know, I'm going to be reading a script, okay? It may be a little tedious, but I'm gonna ask that you bear with me, okay? I always like to be upfront with people so they just know what to expect, okay? Also, you want to let them know, hey, you know, have your Medicare, your red, white, and blue card out, and also your Medicaid card, if applicable, right? Just have that out because I'm going to be asking you for that number again. All right, so give them time to get that, and then you can go and begin the enrollment. All right, this script, we basically highlighted the areas that you are going to be reading. All right, which makes it a lot easier for you since you're going to be filling in an enrollment form on a send. You're going to be reading from a script, right? And you're probably going to be, you know, looking at other things, but just so you have your script, we took the liberty of highlighting the areas that you are going to be reading, okay? So again, it's color coordinated, printed out in color. It's a map for you. Okay, so if they answer yes, if they answer no, and you'll see there, we've highlighted the areas that most likely you're going to be reading. All right. So starting at the beginning here, we have our introduction to this. Hello, my name is Nicole Moore with Diversified Health, and I am a licensed agent in the state of wherever that beneficiary resides in. That's where you should be licensed in, right? And that's why you're talking to them. So whatever state they're residing in, that's what you're putting in there. And appointed by whatever carrier, WellCare, okay? That's the plan name, WellCare. This call is being monitored and recorded for quality assurance. May I have your permission to continue? Okay, so they say yes. And you're going down to, we can only have one sales agent present. Is there another sales agent with you right now? They say no. Let's hope they say no, because there cannot be two licensed agents present at the same time of this enrollment or presentation. All right. So they say no. And you're going to, you are not required to provide health-related information unless this information is needed to determine your eligibility to enroll in the plan. If you choose not to provide the requested health information, you may not be able to enroll in the plan. Do I have your permission to submit your enrollment to CMS? CMS is the Center for Medicare Services, Medicare and Medicaid Services. All right, they say yes, you're just continuing. Do you, for instance, it's going to be how it's written on their Medicare card. Do you, Nicole T. Moore, understand you are requesting enrollment into the WellCare Liberty Plan, a Medicare Advantage, let's say, dual special needs plan? Okay, so you're picking whatever plan it is that you're enrolling them in, whether it's HMO, HMO POS, PPO. We don't really do private fee-for-service plans. And usually you're not going to be doing a standalone prescription plan. Okay, so it's either going to be HMO, HMO POS, PPO, DSNP, and in some cases we have CSNP, which are chronic special needs plans. All right, so they say yes, you're going to continue. Diversified Health is a licensed and certified representative of WellCare and may be compensated when enrolling you into this plan. Are you completing this application for yourself? Whether they say yes or no, it's giving you directions on where you can go. If you're speaking to an authorized representative, or you have someone, let's say a husband said, my wife is going to do the enrollment for me, right? I have a problem with my hearing and I would rather her do the enrollment for me. That's okay, as long as he states, I give my wife, whatever her name is, permission to do the enrollment for me on the recorded line. Okay, so you have that recorded line that's there to back you up in a way and protect you as the agent. Okay. So are you completing this application for yourself? Of course, if you're doing it with an authorized representative or legal power of attorney, you're going to that paragraph there that says, can you confirm that you are authorized under state law to complete the enrollment request for whoever the beneficiary is, right? But let's assume they say, yes, I'm completing this application for myself. And as you see there, it says skip to demographic information. Okay, so that brings us right along. Please state your full name as it appears on your red, white, and blue Medicare card. Please state your sex. What is your date of birth? Would you like to provide an email address? Please know that providing your email address, you are agreeing to receive emails from WellCare. They will give you the opportunity to opt in, and you may opt out of future email communications. If they have an email address, great. If not, it's okay. You're moving right along. It's optional. Okay. What is your telephone number? May I have your complete permanent home address, including your city, state, zip code, and county? When you're doing their complete permanent home address, it cannot be a PO box. You cannot put a PO box in the permanent home address section. Okay. It has to be a physical address. Okay. And when you get to the next question, do you have a mailing address that is different from your permanent home address? That's where you can put their PO box. All right. Would you like to provide an emergency contact? If they want to, again, this is optional. If they want to, you're going to get the person's name, phone number, and the relationship to the person. Okay. Would you like to provide me with the name of your primary care physician? Okay, again, you got this on the outbound call. You're just verifying everything that you guys already went over. All right, that it should already be established. Even if you had to help pick a new doctor because their current doctor was out of network, you're going to go over that. Okay, this is the name of your new doctor, and you're going to be considered a new patient with them. All right. So I know it says here, look up requested physician to capture PCP ID. You've already established that from the outbound call. All right. Are you a current patient? Okay, they say yes or no, whatever the case is, but let's say they say yes. May I have your Medicare number as shown on your red, white, and blue Medicare card? All right. You need to be entitled to Medicare Parts A and be enrolled in Medicare Part. I'm sorry, you must be entitled to Medicare Part A and be enrolled in Medicare Part B to enroll in this plan, may I please have the Part A and Part B effective dates as they appear on your card? You get that. And you go down to, again, we're skipping election period, right? Because we are going to be in the annual election period at the time that you start selling. Right? So skipping that section, all the questions to qualify them, we don't have to go over that because they don't need a special election period starting AEP. So you're going to go right to required questions. Right? Some individuals may have other drug coverage, including other private insurance, TRICARE, federal employee health benefits, VA benefits, or state pharmaceutical assistance programs. Will you have other prescription drug coverage in addition to well care? Right? And if they do, like say for instance, they have a state pharmaceutical assistance program, okay, or SPAP, right? Of course, you've done your due diligence. You're a master at your craft. You know the state that you're working in has a state pharmaceutical assistance program. For instance, in New Jersey, there's PAD, P-A-A-D, okay? And that's prescription assistance for the aged and disabled. If you're in New York, you know they have EPIC. If you're in Pennsylvania, you know they have PACE and PACE-NET, right? Rhode Island, Wisconsin also has a SPAP. So at that point in time, this is where you're going to list that information if it's applicable, and you're moving right along. It does not disqualify them from the plan. Right? You're just stating the information, whatever information you have, you just fill it in. All right. Do you live in a long-term care facility, such as a nursing home, but not an assisted living facility? They say no, you continue. Are you currently enrolled in a state Medicaid program? Okay. What is your Medicaid identification number? If they say yes, if they say no, you're continuing with the no column. And you're moving along to the next page. Do you work? Does your spouse work? Okay. You're getting clear yes or no answers. Yeah, okay, yeah, is not efficient. It's not sufficient, I should say, enough. You have to get clear yes or no answers. Mrs. Jones, I need a clear yes or no to the question. I'm going to ask the question again, and I need you to answer accordingly. All right. So if available, would you like to receive your plan information in a language other than English or in an accessible format? They say no, English is fine. Would you like to receive your plan materials in large print? And then you're going to the statements of understanding. Okay, as you see here, it's highlighted. You're always reading that. All right. After statements of understanding, you're going down to, I need to review several statements with you and need you to understand and agree to these statements in order to apply for this coverage. Stop me if you have any questions or would like me to repeat any of the information. Okay. Now, the next box here says if MA/MAPD. You're always going to be doing an MAPD plan. Okay. You may do an MA only plan if the person has veterans benefits. Again, that's something that we go further detail in product training. But you're always reading this box here that's highlighted. Okay, so whether you're doing a well care plan or all well plan, you're picking either or. Okay, let's assume we're doing a well care plan. Okay, because that's what's available in the area that the beneficiary resides. So we're reading the top portion. Well Care Health Plans Incorporated is an HMO, PPO, PFFS plan with a Medicare contract. Okay, and then you're going down to, if you're doing a DSNP plan, you're reading that middle paragraph there, right? WellCare, DSNPs have contracts with state Medicaid programs. So if you're doing a dual special needs plan, if you're enrolling in a dual special needs plan, you're reading if DSNP portion there, okay? And for any plan that you're doing, whether it's DSNP, HMO, PPO, HMO, POS, you're always reading that last paragraph in this column box here, okay? So enrollment in their plans depends on contract renewal. You must keep both hospital Part A and medical Part B to stay in WellCare. All right. Then you're going down to where it says for all plans, you're reading that. And next, continue for all plan types. You're reading everything there. All right. And going to the next page here, continuing at the top there, reading everything that's highlighted. Where it says plan name, you're filling that in with WellCare or All Well, whatever plan you're enrolling them in. Okay. As you see there, that's highlighted, if MA/HMO, HMO, POS, PPO, or DSNP plan. You're reading that left column there all the time. I haven't seen any PFFS plans. I don't think there's anything for the upcoming year. Haven't seen it in any of the trainings. So the box that's highlighted, that's the only box you're going to be reading. Going down to required disclaimers. I know this question at the top here, does the plan have a monthly premium? I know that's highlighted. You're not reading that to them. It's in italics. That's for you and your knowledge only. So it's basically asking you as the agent, does the plan have a premium? If the plan does not have if the plan has a premium, you're reading the if yes box or column. If the plan does not have a premium, you're reading the if no column. All right. So the plan have a premium, you're reading the if yes box, and you're continuing to the next page and always, always, always reading this paragraph. All right. It discusses what extra help is. It discusses extra help or LIS is, and it discusses how they can get it, right? It discusses the part that if they have an LIS, they wouldn't be responsible for a late enrollment penalty, which you went over and is now verified and confirmed in this. You went over that in the bridge statement, right? So anybody, for your knowledge, that has a low income subsidy, they are not subjected to a late enrollment penalty. All right. Remember, LIS or extra help handles prescription drug costs. That's a prescription drug cost. Because they did not enroll in their prescription drug plan at the time that they qualified for Medicare Parts A and B, they would be subjected to a late enrollment penalty. However, they have an LIS that will help them with that. So it's not applicable to them. All right. And this is where you're going to get to where they're picking their payment option. Please select the premium payment option. Electronic funds transfer from your bank account, Social Security deduction, Railroad Retirement Board deduction, or get a bill/coupon book. This is where they're going to say coupon book, right? There's going to be some people that forget and they're going to say Social Security deduction. Not the end of the world. You can go back and say, Mrs. Jones, this is the part that I was talking about where, you're going to receive a coupon book with $0 because the system just defaults that way. So, I can repeat the payment options and you can answer accordingly and let them answer. If they say Social Security deduction, no big deal. It's a zero premium. There's nothing going to come out. You just check off accordingly and read the part that they say. But more than likely, they're going to be saying coupon book, right? And you're just reading the coupon book option column there. All right. Always reading disclosure and release of information. It's all highlighted. You're not skipping anything. and then confirmation of enrollment. I just want to confirm with you that this conversation and the information I've received from you today will become your official decision to enroll in our plan. If approved by CMS, you'll be enrolled in our WellCare Liberty plan, dual special needs plan. All right. This next part here on the top of the page is extremely important. Do you agree? Do you understand and agree with all the statements I just reviewed with you? If so, please state I agree. You have to get them to say a clear I agree. Okay. If they don't say I agree, Mrs. Jones, I'm going to ask the question again, and I need you to state I agree if you agree. Okay. This is your verbal signature. Okay, this is how they're going to sign their enrollment form. All right. Once they agree, you're reading the if agreed column there. All right, the entire thing here. If you have any questions about the plan's benefits or any additional Medicare services, please call WellCare customer service at what I'm going to suggest to you. Don't give the WellCare customer service. You're their advocate. You're working on their behalf. That's one of the things that Diversified offers to our clients, that we do the footwork for them, right? No, we're not going to have them call WellCare and wait on hold and ask questions that they have really no knowledge about. And no, we're gonna do that call for them. So we're going to be the first point of contact for them. All right. So where it says the number for customer service, you're not providing that number. You're just going to provide them with that 1-844-244-8000 number and your extension for them to get back to you directly. Okay. This is a way to help retain your business. Okay. It's an efficient way to have that, what we offer, that contact with your clients. And it's a way for you to provide a service that a lot of people aren't providing, right? Okay, where you're going to advocate for them. You're going to do the footwork for them. If they need help with, say, their over-the-counter benefit, you're going to be the one that they call first and foremost, right? You don't want your client waiting on hold with WellCare. And because they're waiting on hold with WellCare and don't have a direct contact, they cancel the plan. All right, so always be the first contact. Scratch that number out, put your contact information and the times that you're available. Okay. Right after this, I know it's not listed in here, you're going to go into a health risk assessment. Okay. This is where you just ask them a few questions to jumpstart their plan and see where they are with, certain things. It's like a survey. Okay. And I'm going to suggest, and I know Dan touches on this later on, where it's very beneficial for both the client and yourself and the company, WellCare or Centene, to do the health risk assessment. All right. So just make it a part of your process. At the end there, when you give the confirmation number, you're going right into a health risk assessment. Right after you give the confirmation number and you ensure that they wrote it down, go right into your health risk assessment and then give them your contact information for them to give you a call back directly. All right. This completes your application. Have a great day. Any questions on the inbound script or enrollment script?
Nicole, after we do complete the application, are we supposed to give them like an application ID number?
That's your confirmation number.
Okay, that's it. Okay.
Yes. All right. So
Go
ahead.
Just a quick question, because I know that in order for you to do the enrollment, it has to be an inbound call, correct?
Yes.
So now let's say because older people, they can be a little anxious and they want to hurry up and get the process over and done with. What if they hang up on you? Are you still allowed to at least call them back and then tell them to call you back, or no?
Absolutely. So in that case, if they hang up before, excuse me, if they hang up before you get it across that they need to call back, definitely you're calling them right back. Hey, Mrs. Jones, we must have gotten disconnected. Excuse me. Mrs. Jones, we must have gotten disconnected. And just go right back into your presentation where you're telling them, you know, Medicare.
No. I mean, when it's in the enrollment period, like when you're trying to now,
Oh.
you got into the enrollment, because I know that it is recorded. Is that allowed, or have you ever had cases where a client has hung up on you during the enrollment part?
In the middle of an enrollment, yes, you would just call them right back. I'm sorry, Mrs. Jones, it seems like we got disconnected there. And then, you know, did you hear everything that I said? Would you like for me to start from the beginning or just repeat the last section? You let them choose on the, I'm sorry, no, I think they have to call you back. They
Okay.
I'm sorry. I'm thinking, yeah. So they have to give you a call back. It has to be on an inbound call, even if they hang up. I'm sorry, I'm choking here and I can't multitask.
It's okay.
So if they hang up in the middle of an enrollment, you have to give them a call back, okay? And let them know that, yeah, you got to give me a call back on the inbound call, so that we can get your enrollment in place for January 1st. Okay,
Okay.
you just have a little bit left here. There's just a little bit more that I need to read. I'm going to give you the confirmation like I stated before, and you'll be all set for January 1st.
Okay.
Sorry about that. Any other questions? Again, I want to mention that you Google what the Medicare card looks like. Okay, you want to be able to explain that to people that you're speaking to. You want to know that the Medicare number is comprised of a series of letters and numbers, right? You also want to know for your for your use that in that Medicare ID number, there will never be an S, L, O, B as in boy, I, Z, okay? We've kind of made up our own acronym, whereas it's SLOBIZ, SLOBIZ, okay? Those characters will never be in a Medicare ID number, okay? So if a beneficiary is reading off their Medicare ID and they say, oh, it says here S, you know, it could be maybe an 8 or a 5, and they're having trouble seeing that, right? So just to, you know, eliminate any mistakes or eliminate you calling SPOP with the wrong number and having to go back to them and say, can you verify that number? You know, as the expert, that the Medicare ID will never include SLOBIZ, SLOBIZ. Okay, remember what I said before? You want to try to eliminate agent jargon. Even if you do use an acronym like LIS or CMS, just follow it up with a brief explanation of what it is, okay? I think here, what else that I need to. I think that's basically it. Any questions? Other than that, you'll be able to, what I'm going to suggest after getting off this call is just going over the scripts, reading through them, familiarizing yourself with them. Google what Medicaid looks like in the state that you're going to be calling, or the states that you're licensed in. Be proactive. Google those things. What do they refer to Medicaid as? How does the Medicaid card look, right? Do they in fact have a state pharmaceutical assistance program, right? Things like that, you just want to know. beforehand. So study your craft. All right, so I think that's it for me. If we don't have any questions, if you come across any questions, you can always reach out to me. My number is listed in the point of contact list. Email, call, whatever the case is. All right. And I think that's it for me.
Can I ask one more question? I'm sorry.
Sure, absolutely.
In regards to the when you ask about their prescriptions and their doctors, is there a list that is on that is in front of us that we can look at to see if they're verified as well, or no?
Great question, Shania. It's actually what comes up next in the entire process. At this point in time, we're going to ask Jeanette to come on, unmute and come on board. What she's going to do is she's going to take you through. At this point, you know how to say everything, but you don't know where to look up a doctor. You don't know how to find if they're in the system. You don't know how to look up a drug. You don't even know what plan you're going to sell depending on the person's need. So all of that is done in one location, and that is called Ascend. As well, Nicole talked about, LIS and Medicaid and what a dual is and all that stuff right there. But everything is done on the platform, the enrollment platform, and that's Ascend, and that's what Jeanette's going to take you through right now. So great question, Shania. Thank you for the lead-in.
You're welcome.
All right. Hi, everyone. Okay, so the first things first, you are able to find the website for Ascend on the div.com/telesales. Once you go in and get the website, it will ask you to log in. Your login information, your username is going to be the email that you used when you onboarded with WellCare. And then your password you're going to use is WellCare with a capital W, 1, 2, 3. Once you log in, it will ask you to change your password. Okay. The first thing it will ask you when you log in is the zip code of the member that you are working with. So you will type in that zip code. After you do that, there's something that comes up as the blue button from Medicare. As a telesales agent, you are going to choose no, I prefer to enter my information manually, since you do want to enroll this member right now. If you choose connect to mymedicare.gov, it'll take you to mymedicare.gov, and then you won't enroll that member. I do also want to let you know that when you log in, you want to make sure that your name, email, however it comes up, is towards the middle left side. If your name is not there, you will not get credit for that enrollment. And it is a process to get you that credit. After that, it does bring you to the pharmacy search. If the member wants a pharmacy covered, you would choose yes. And you would type in the pharmacy name, a list of pharmacies will come up. If they don't want a specific pharmacy, you can just click no and move forward to look up the prescriptions. When you do the pharmacy search, it does generate a list for you. You are able to click on the pharmacy that the member would like and save it, and it'll formulate in a list for you. Once you do that, you can click continue. This is where it asks if the member takes any prescriptions. If they do, you would choose yes. If they don't, you can just choose no. There are two different ways to look up the prescriptions. There is one where you just start typing in the name of the prescription. And then there is one where you can just click the first letter that the prescription begins with. Once you start typing in the name of the prescription, it will generate a list for you. And if you see the prescription there, you are able to click on that prescription and click add. Again, if you pick the first letter of that prescription, then it'll generate a list for you. You find that prescription and you also would choose add. You have to make sure to choose add in order to populate on the list. There are medications that will ask for the dosage that the member takes, so you will have to fill that information out as well. Not all medications ask for the dosage, but some of them do. Once you choose that, you're going to choose the dosage, the packages, how many packages the member needs, how long does the prescription last. If there is a generic alternative for that medication, there will be a pop-up. Now it all depends on what the member takes. If they take the generic, you will choose OK. If they don't and they just take the brand, you would choose cancel. And then you would add to prescriptions. A list of prescriptions will generate for you. You are able to edit that prescription just in case the dosage is incorrect. If they don't take that medication, and you're able to remove it as well. You would click continue once you verify that. And it brings you to the doctor search. If they have a doctor or specialist that they want covered, or you need to check if it's covered, you would choose yes. If they do not have a doctor, then you would choose no. You are going to be able to type in the doctor's name, make sure the zip code and the radius are correct. There is also an option to do an advanced search for the doctors as well. This is what the advanced search looks like. You do want to make sure you look up all of their doctors. So that's including their primary care physician and their specialist as well. The only thing is that on the enrollment, it only asks for the primary care doctor's information. It does not populate a list for you for all the doctors that they see. Once you search the doctor's name, it will bring up a list for you. If you want to see more information about the doctor, you would choose more. If you know that's the doctor they see, you would choose add. And it is very important to write down the NPI number because it does ask for the doctor's NPI number on the enrollment form. Once you choose the PCP, it will be on, it will generate in a list and you can click continue. If you do view more information, it does give you the information of the NPI number, whether they're accepting new patients, if they're a primary care provider, the office phone number, the plans accepted, hours of operation, and things like that. Next, it'll bring you to the eligibility check. If you are checking eligibility on Ascend, you would choose yes. If you are not checking eligibility on Ascend, you would choose no. You do need to fill out the first name, last name, date of birth, Medicare number, and either the Medicaid number or Social Security number, and the gender. Then you would choose check status. Now with checking eligibility on Ascend, it does let you know if they're LIS level 1 at 100%. It will let you know if they have Medicaid. It just does not let you know which plan which D-SNP plan they are eligible for, like SPOP does. So then you would check the status, and then it brings you to the plans available in the area. So in this zip code, the Freedom Plan is available. You are able to compare plans available in that area. You are able to apply now, view details. When you choose to view details of a plan, It does bring up a summary of benefits for you. You are able to apply now or go back to different plans. This is what it looks like when you compare plans in that area. Okay, we're going to skip through that. And then it'll bring you to the enrollment application when you choose which plan you're going to enroll that member into. Once you choose apply now, it will bring you to this screen. You will need to fill out the first name, middle initial if given, last name, gender, date of birth, email address if given, phone number, and an alternate phone number if given. There is an option to save the application, and there's also an option for send for signature. As a telesales agent, you don't send for signature, but if you do hit that option by accident, you can just cancel and go back to the screen you were just working on. Once you fill out that information, you would click next. Then it asks for the permanent address. You're going to fill that out. And like Nicole mentioned earlier, you cannot put a PO box into this portion of the application. If they do have a PO box that they use, you are able to fill it out in the mailing address portion. But you need to make sure that you check off that in order for the boxes to be populated for the mailing address PO box. After you do that, you would click next. This is where it asks for the emergency contact. Once you start filling out the first name, all 4 boxes need to be filled out. If they don't provide you with an emergency contact, then you can just keep going and choose next. Now this is where it asks for the primary care doctor. In the primary care provider, you will be entering the NPI number. If by chance you don't have that NPI number, there is an option here to do the provider lookup, and you would just have to make sure to add that doctor and it'll generate automatically for you. If you do have the NPI number, you're going to enter that NPI number, the first name and the last name, and if they are a current patient, yes or no, and then you would click next. This is where it asks for the Medicare information. If you do an eligibility check on a send, this will automatically populate for you. If you do not do the eligibility check, you do have to manually put in the Medicare number, Part A and B effective dates as well, and choose verify. Then you would click next once you verify. This is where it's asking for the special election period. And since we are going to be working during open enrollment, this will not be there. There will be an option just for the annual enrollment period. You would choose that and you would click next. If by chance it is outside the annual enrollment period, then you would choose that my situation falls under one of the special election periods, and the list will populate for you. You would choose a special election period and click next. This is where it asks about the other living situations and health services. The ESRD end-stage renal disease question is no longer on the enrollment. This is where it asks if they have other drug coverage, if they're a resident of a long-term care facility or a nursing home, if they do have state Medicaid program. If they do have Medicaid, you do need to enter that Medicaid number. It does not automatically populate for you. And then do you or your spouse work? It also asks if they want their information in a different language or if they want it in large print. And then you would click next. This is where it goes over the disclosures that Nicole spoke about earlier and asks for the signature of the member. It will ask if they are doing the enrollment for themselves or on behalf of someone else. You would choose that option. If it is a power of attorney or authorized representative, you do need to fill out their information here. Once you do that, you would click next. And this is where it asks for the payment option. It is automatically set to send me a bill or coupon book. You are able to switch it if needed. Once you make that choice, you click next. And this is where you would review the application with the member. If there are any spots that are wrong, you are able to edit that portion. Once you make sure everything is correct, you would choose apply now. And then it'll bring you to a screen like this. Your confirmation number will always be in bold. And then we ask that you print the application, save it as a PDF, and send it to myself with any notes that you take on that member. And then there is the option for the value-based enrollment, the HRA, that Nicole mentioned earlier. There are 4 options now. There's a connect me now, schedule a call back. The agent does it right then and there, and then decline. Any questions on Ascend?
I have a quick question in regards to the prescription part. Is it important to know the current medications that they're taking, even if they're, sometimes clients, they get prescribed something, but they're not actually taking it. Do you need to know everything that they are actually prescribed and not just something that they're taking currently?
I would definitely check them all out, any of the prescriptions, because if they take it again later on, you want to make sure that they are a part of the formulary.
Okay, thank you.
If you do need any help with Ascend, you are able to contact me and I am able to assist you. My contact information is on that contact sheet as well. And now I will pass it on to Nikki.
Hi, everyone. This is the 5.9 application dashboard. When you get your login information, you'll log in and download this. There's just 2 buttons that you click on. On the dashboard itself, your skills will actually say which states that you have that you're calling. Here you'll find the email address attached and your extension will be right here next to it. If you want to make a manual call, you're going to go to this call button here. It'll show you if you're in any active calls. If you are in an active call, you will not be able to make another call over it. You'd have to disposition it first. But when you are making an outbound call, you can either type in a phone number fully. And once the full phone number is there, the gray dial button will turn blue. If you're calling from, let's say, New Jersey or New York, in these campaigns, they will actually show the states that you have assigned to you, and you want to call from the state that you're calling into. So if your client is in New York, you want to click on New York. That way you are actually calling them from the New York number that they'll recognize. You can also, if you wanted to make a call into SPOP, we do have the phone numbers already in here for you. And same thing, if there's anybody that you wanted to call in agency, you'd be able to start typing in a name and they would also pop up for you. You can also select a contact and then choose it from here as well. If you have an incoming call, I'll show you what that looks like. I'll show you this. This is what the screen will look like if you have somebody on your screen. You'll have your hold button, transfer, mute, conference, and a keypad. You'll have all the information here that's relevant for you. And then there will be more information that you can find. If we have it, you'll have it. It will be in it, the contact record. If you go to contact lookup, it will show up here. And you can select the contact and it will, oh, usually this will come up, but you can also type the number in here. And then once this loads, there is all the information we have, you have, and it'll be right here for you. If you make any notes on them, the notes will show up here. If you made any comments during the call, they'll show up here. You'd be able to fill out the comments here. And this is all, if they, let's say that's no longer the address, you can just delete it and change it to something else. And this will save automatically. There's nothing you'd have to do except just fill in whatever information that they give you that's updated. If you're going to set a disposition for doctor not in network, there's only going to be 3 that you would do, which is doctor not in network. You would put what their doctor is here. If their prescriptions weren't covered, which ones weren't? And if they have a med sup plan, which plan do they have? If they did not want to give out the information, but that's where you ended up, you can just put NA. When you go to end the call, this will stay here until you set a disposition. The disposition is the last thing that you want to do. If you are waiting for an incoming call for sale, like you would click on this one, and then you would make sure you're in a not ready state and wait for that inbound call to come in, and then you would pick it up. Callback is if you built no rapport with them. They're just like, oh, they're not in right now, or I can't really speak right now. Can you call back at another time? You just do callback. Would not probably be using this right now. If you do start before AEP, you're going to want to use scheduled callback if you build rapport with them. That way you can hold on to that lead for when you call next month. Customer hang up, they hung up on you. Deceased, the member's deceased. Disconnected number is also not in service. Their doctor's not in network. Future lead, they're aging in. And the no SCP would be there's no special election period for them. They have their Medicare SLUP. Language barrier. Left message is if you leave a voicemail for them, you would choose that. And that's only when you're doing it originally. So if you first make your call, nobody picks up, and you want to leave a voicemail for the member to have them call you back, you would choose that one. Member no action needed is if they are already in a plan and there's nothing more you can do to help them, or you're going to do that after every time you talk to one of your clients that you actually enrolled. The initial one will be sold, and every time you speak to them after that, you want to do member no action needed. That way the system makes sure to not call it. Even if you left them a message, but they're your member, or they asked you to call back and they're your member, this is the one you want to use after all of that. And then you can put in the comments what your notes were when you called them. NQ Medicare eligible, they're missing parts A or B, not in service area. there's no plans in the area, no interested, there means they're not interested at this time. RX not covered, so their prescriptions. Scheduled callback, you use this one when you actually build rapport with the person. Right now is not a good time to finish going through everything. And you schedule a time to call back with that person. You will click on scheduled callback, and then you will create a reminder for yourself. Or you create a reminder for yourself first and then click on scheduled callback. Sold is you enrolled the member, wrong number, the number on file does not match the member. When you go to create a reminder, you would go up to this little calendar up here, click on new reminder, and this will pop up. The reason I say do that before you set the disposition is this way it attaches all the information for you. It attaches which campaign you called from so that it will automatically call back from that campaign. It attaches the phone number and the name. You would write any relevant information you want to remember on that reminder in your notes up here, and then you would save it. This box will pop up at the time and date you select. It will give you a reminder to call. You can either snooze it for up to a week if you're not ready at that specific moment to give them a call back. Dismiss it completely if you already spoke with them. Complete it if you're done with it. You can edit it, or you would make a call from here as well. If you are still in an active call in the back, this will remain gray and you won't be able to make a call. But if you set your disposition, you're not in any calls, and this pops up for you, that'll be blue, that'll be green. And then you'll be able to make a call right from there. It'll make sure it'll say return call, and then it will dial it for you. When a call comes in, it'll show up down here on your screen, and you can click on it. If you miss it in the call, it'll actually show a little button that somebody's calling in, and then you would click on the personal queue, it'll pull it up. The only way you can pick up a call is if you go into ready voicemail. Once you do that, it'll pop up. You can hit your accept button. And then you'll be in the call with the person. And when you're in an active call, then all these buttons are available for you. If you want a conference, you want to do a warm conference, that allows you to speak to the other person first before adding in the other party if you have to. But this is the one you want to do. Cold just has all the members on the line at the same time, or all parties on the line at the same time, but just warm is what you want to do. And then same thing here. You can either select the contact, start typing something in, type in the person, phone number, either way that's easiest for you. Even if you or the other member ends the call and it's out, like I said, dispositioning would be the last thing you do. The calls will not end, even if it is ended. It will not go away until you set a disposition. If you need to add to a DNC, it's here. If you ever accidentally add someone to a do not call, you can reach out to me. My contact information is also in there, and I would have to just remove them on my end. You just send me the phone number and I'll do it for you. If you set your own wrong disposition, call it back quickly and hang up and then set it, because you want to make sure it's set under the correct campaign. If the disposition is not matching the campaign that you originally got it from, the system will call it again. So if it was your member that you sold, but you're making them on main inbound instead of where they are stored in New Jersey, then the system won't know that the New Jersey campaign should be sold. It'll just think that it should be sold in this campaign. So you want to make sure that you are using the correct campaigns and the correct dispositions so that you keep a hold onto the members that you want to. If you have any voicemails, they'll show up here. There'll be that little notification as well. You would be able to click on personal voicemail. It'll pull up and it'll have a list of all your voicemails that you can listen to right there. You'll also get an email sent to you when you have a voicemail alert as well. So if you're not logged in and a member calls you back and leaves you a voicemail, it'll get sent to your email. The contact record, that's where you can put in a name or the phone number. The phone number is the best way though, if you have, and to pull everything up, see everything here. If you forgot to add a reminder, but you either remember the phone number, you can bring it here and you can actually add a reminder right from here. It would do the same thing where it would just attach it for you. Or if you go to my activities, you'll be able to see the last person you called, what your disposition was. If you have a missed call, it'll show up as a red circle. And then same thing, you can click on this little folder here to see all that contact information. You'd be able to open the contact up and then it'll bring you back to the screen where you can add the reminder. You can also just do it if you without being on those screens. It just won't have the information for you. You'd have to add everything in manually and make sure to change the campaign as well here. When you click on view all, you'll be able to see all your reminders. If you still have things pending, it'll show up here. If they're missed, it'll show up red. If it's still not at the time or date yet, it'll show up blue. And then the completed will stay down here. And then you can use the sort by buttons up here if there's a different way you want it sorted. But instead of due date, you could do it by name, number, or if you want it sorted the other way. Up here, you'll also have your address book that you can click on. And from there, you can either call directly from the address book or instant message directly here. The instant message works like any messaging service. You can just type in somebody's name. If they're online, they will be green. If they're not, it'll be gray. And then you'll just be able to click on them, confirm, and then you can just type it. If they are not online, you can still send them a message and they will see it when they get online. But that way you know whether or not the person's actually logged in and would see it right away. When you end a conversation, it'll end it for all parties that are involved. So it basically will close out the entire thing. If you click on this too and view all of your stuff will be here as well. If you forget to do the do not call and you don't want to call them back, you can click up here. There might be the little add to do not call and you'll be able to do it that way as well. There's a help section here. If you want keyword shortcuts or the guides or anything that might help you as you change your password. There's some stuff here. And under your name is where you're going to log out or your settings. At the end of your shift, you do want to log out. If you just close the browser, it has a chance of getting stuck. And then you'd have to contact myself so that I would be able to force log you out because it doesn't allow more than one session going on at a time. And if it thinks you're still logged in because you just closed the browser, you won't be able to get back in. In your settings, you'll have your general, which won't have anything, your voice channel, which this is where if you'll have your enable pop-up windows from reminders, you want that checked. This is auto answer. This is only, it's up to you whether or not you want the system to pick it up if you're available automatically, or if you want it to actually ring and you choose to pick it up. If you have these checked, like I said, the system will, if you're in a green ready state and you're not in any call, it will just automatically just take the call without it ringing at all. If you want to upload a personalized voicemail, it would go into greeting. I would send you the website to download Audacity. You would download that, record your voice message there, send it to me, I'll format it properly, and then you would select your file, put it in, click upload and apply. You do have to click both upload and apply for it to actually save in here. Your audio devices will show you which ones that you are talking from or listening from. If there's ever a time where it feels like a lot of people are hanging up on you, it might be that they don't hear you, or vice versa, you don't hear them. And this might be mismatched. Sometimes it might just choose one of the other random speakers in here or the microphones if you have a webcam attached, if you have something attached to your laptop. It may just de-pair them, and you just want to make sure that these are always the ones that you want to use. Your sound alert are for your reminder callbacks. If you're getting an incoming call, any of these, we suggest that you have these all clicked on. I think by default, it's only a few of them, but this is how you actually get sound alerts too, so that you know when you have an incoming call, when your reminder pops up. That way, if you're not on the actual desktop, but you're looking at something else real quick, you'll be able to hear it come through. When you're ready to start calling, you would go on the ready voice voicemail. When you do this, that's when the leads will start populating into your system. They will not come in if you're not on both voice and voicemail. When you're ready to take a break for the day, or you're waiting for your member to call back in, you want to go to lunch, whatever it is, you're going to want to choose one of these, and it'll stop the system from calling. When you're in a call, you want to do that before you hang up the call. Because you'll see here, it'll have the pending state. If you don't do it before you disposition the call, the system will just dial on to the next. So if you're really waiting for that person to call in, you don't want somebody else to pick up the phone because the system started calling. So you want to make sure that you see that pending state. It'll be vice versa. You would have been in ready voicemail, and then you would go click one. When you see that, you choose your disposition, and it brings it automatically for you. That's pretty much it for 5.9. Does anyone have any questions?
Thanks, Nick. I think that worked. I mean, that helps. We're all set with that part of it. Guys, the bottom line is, Dan, did you have anything else that you wanted to address?
No, I think everybody kind of covered it. We got through the entire system of what to say, how to look up doctors, how to go through, how to enter an app, all that stuff. What you're doing with the actual system. I think the girls and I think the girls covered it. You know, the entire process from beginning to end.
Yeah, I think we're all set. If there's anything that we could do to help, obviously we're here. Next step is to just practice, and then get your script over to Jeff and do a role play with Jeff. he'll be the one that you kind of go to next. And then from there, we'll be all set. Anybody
And
have any other questions in general or anything?
Michael, if we can just put on the screen the tips from the most successful agents. I don't know if we can just do that really quick.
I think Jeanette's got that. 1
All
second.
right, awesome. So there's some tips here from the most successful agents on our team here at Diversified, and they just had some pointers here for you that I always like to share, because they say surround yourself with successful people and you are going to be successful, and that's by default, right? So number one here, the most influential agents say you must double tap. What is a double tap? You're going to dial each number twice in a row to give the client more time and a sense of urgency to answer the phone. So if you do not get an answer on the first time that you call, you're not leaving a message. Okay, you're going to build some curiosity, sense of urgency, and you're going to call back again. Most telemarketers, they're not going to call you twice in a row, right? Because they're on a dialer system. We are in fact not. So we have the capacity to call them right back. And if you don't receive an answer on that call, on that second call, that's where you leave your message, right? And with that, I just want to add, leaving a message, it should be short and concise. It should leave curiosity. You should not be selling on a voicemail. Okay. Number two here, answer rates are higher when you are calling from a local number. So we have, again, the capacity through 5/9 for wherever area you're calling into, we have it where you're calling, a local number is showing up if they have caller ID. All right. Number three, ask who else in the house is on Medicare. So there's always an opportunity for you to not only get one sale in the household, but multiple sales, right? Because there may be a spouse there that also have a WellCare plan or have some other plan, but they're on Medicare and they also need you as an advocate, as their agent, to go over some other options that they have through Medicare Advantage, right? Number four, it's a numbers game. The more you dial, the more sales you will have. Proven fact, right? Dial, dial, dial. Not only dial, but smile and dial, right? Because your tone means everything, but it's definitely a numbers game. So get your dials in, right? It's going to be successful for you. Number five, you know more than they do. Okay, I live by this. You've studied, you've got your insurance license. They are not licensed. I don't care if you're calling a doctor, a nurse, someone that worked in the doctor's office and may know a little bit about the, some benefits and things. You still know more than they do. Okay. And you will rely on the fact that Medicare is super confusing and pretty much people don't know what it entails, right? Or the options available to them. You're the expert in this, you're licensed in this, you know more than they do. Number six, leave a detailed and informative message. I'm going to go back to let it be short and concise. Mrs. Jones, this is Nicole Moore calling on behalf of WellCare, your Part D prescription plan provider, calling to go over some benefits that you may be entitled to with your WellCare plan. Please feel free to give me a call back at 844-244-8000, extension 834. Thank you, and I look forward to your call. That's simple. All right, so you want to find a way to create some urgency. You don't want to start going into benefits on a voicemail, etc. Stay with the times, discuss current climate, current events. There's things going on with COVID. There's things going on, you know, you can bring up the area that you're calling. I had one of my agents that used to Google by the town, their weather and talk about the weather, right? So stay with the times. Number 8, make sure you ask good questions. The ones that ask the questions are the one that is in control. Right? And then asking good questions, you find out how to sell these people. You find out their need. You find out, you know, a lot of things if you just ask the right questions, right? So the quality of the questions you ask will determine the quality of telesales agent you are, or will be. And number 9, participate in every conference call. Going back to what Michael touched on, there is a conference call every Wednesday at 6:30 in the evening. I'm going to advise you to get on that call, okay? Because there's a lot of information that you can gather from that. And again, I live by surround yourself with successful people, right? You learn from each other. You can bounce ideas off each other. You may learn a new way to rebuttal to an objection, etc. Right? So participate in every conference call. And those are the tips from the most successful agents that we have here.
Just real quick, I did forget to say to double tap, when you're done with a call, it'll actually ask you, do you want to dial another number? Yes means that you'll dial the same number or a secondary number that may be on that person. No would go to the next person on the list. So the first time you want to hit yes, the second time you would hit no.
All right, awesome. Unless there's any other questions, I think we are actually wrapped for today. We went a little bit longer than expected. But as Mike said earlier, the #1 goal here coming out of this would be for you to kind of study, role play, whether it be with your someone in your house, somebody you live with, whatever it may be, or if you even are ready for Jeff, say it out loud. If you're ready for Jeff, we can share Jeff's number right now, and then you can give him a shout, schedule a role play, and then we ask you to role play with him. At that point in time, we get you right into the system. His number is 973-233-6843. 6843. 6843. And that would be the next stage in the process. When you get through role play, you'll be able to get a login from Nikki. You'll get your WellCare login right from the Ascend platform. You'll be able to just dive in, and Nicole's always listening. She's kind of our ears everywhere, always kind of working through. If you need to get her, you can give her a shout. Her last 3 is this. Her phone number is the same. The last 3 changes to 834. So 973-233-6834. And at that point, you're off to the races. You could ask Jeff, you could ask Nicole, speak to me, speak to Mike. We'll get you appointments when you're ready. We'll get you live transfers when you're ready. Otherwise, you guys are all set and ready to go. Anybody have anything? Questions, comments, concerns, anything?
Good luck, guys. Thanks for your time, and let us know if you need anything. Have a great day, and we'll hear from you soon. Tonight,
All right.
6:30. Don't forget, every Wednesday night, 6:30.
Do well, everybody.
See you then.